Okay, so good day everyone. Our next topic would be regeneration and healing. So in this topic, we're going to review the normal physiology and concepts of your cell proliferation, cell growth, cell cycle, and cell differentiation. No, kasi nga, nagre-regenerate siya and heal. So we also understand the basic factors of your tissue regeneration, understand the relationship between cells and their extracellular matrix, understanding the roles of the major players of healing, your angiogenesis, your growth factors, and your fibrosis. So we very important also is we differentiate between your primary and secondary intention healing. Okay, so first our definitions. So regeneration versus healing, very important. So regeneration is a normal process. So there is growth of cells to replace lost tissue. So walang injury. While healing, kailangan may injury, it follows damage. So a reparative tissue responds to a wound, inflammation, or necrosis that often leads to fibrosis. So regeneration, these are the replacement of lost structures dependent on the type of normal turnover the original tissue has and can be differentiated from compensatory growth. So an example of your compensatory growth is when one kidney becomes larger after a nephrectomy, no? Nagtagal ng kidney, so lumaki yung isa as compensatory. So, or the left portion of your right lobe of your liver enlarges after um, taking a part of the lobes, no? While sa healing naman, no, nag-repair siya, okay, needs a wound inflammatory process or necrosis. So, many disease appearances anatomically are the result of healing, such as atherosclerosis. So, this often ends with a scar. So, fibrosis, as one of the three possible outcomes of inflammation, follows healing. So, this requires a connective tissue or a scaffold. So, fibrosis occurs in the proportion to the damage of the ECM or your extracellular matrix. So, healing or repair, like inflammation, can be thought of as a predictable sequence of events, just like in the Cecile M. DeMille inflammation epic. Okay? So, cells derived from stem cells can do only three things, no? Your stem cells, di ba? Always niyo siyang marinig sa mga salida na gusto mag annually repair, ana-ana, kanang mga superhero na pirmi mag-repair lang ilang body, no? Cells derived from stem cells can do only three things, no? They multiply, they differentiate, or they die, no? Through apoptosis. So um you must also understand the concept of differentiation. Okay? So you have your first term, no, your proliferation, no, can be hormonal, especially steroid hormones. So differentiation versus multiply, no, it's unidirectional, it's gain versus loss, and apoptosis is one of the most key concepts in your neoplasia. So later, no, ma-expound naman yan. So you have your ectoderm, your mesoderm, and your endoderm. Okay, so cells from these three areas behave similarly, no? And look similarly. Pero basically, your epithelium, as you know in your histology, epithelium versus connective tissue. So your epithelial, no, are from your ectoderm and your endoderm. And while your stromal, no, is from your um, connective tissue or your mesodermal. Okay, you have the four phases of your cell cycle, your G0, your G1, your S phase, and your G2 or your pre-mitotic phase and mitotic. Okay, so we have your G0, your quiescent, no? This is not a very long or dominant phase. So G1 is pre-synthetic, cell growth taking place na. As cells have continuous turnover, have longer or larger S phases. So DNA synthesis. So S phase of tumor cells can be prognostic. So G2 pre-mitotic or if you will post-synthetic. So M mitotic, P mat, di ba? Alam natin yan dati yung P mat. So and then your cytokinesis. Okay? So ito yun siya, no? So G1, no, the growth has uh the growth has taken place, while your S cells, no, growth and DNA synthesis cells which have continuous turnover have longer or largest S phase though. Okay, so dito na din yung DNA synthesis sa S phase, no? So your G2 is pre-mitotic, no, or post-synthetic kay post-S. Okay, then your mitosis, you have your prophase, metaphase, anaphase, telophase, mo na ni itong mitotic na always ginapahimo sa to sa science sa una. Okay? You can classify cell types. It can be labile, no? Your marrow, and your GI, quiescent, your liver, your kidney, your non-mitotic, no, hindi sila nag-regenerate. It's your neuron and striated muscles. Okay? Your stem cells are totipotential, no? You have your embryonic and adult. Okay, so your toti from omni and pluri, no? These terms are often used interchangeably pero perhaps not totally correctly, no, ginagamit. So your embryonic stem cells, no, your knockout mice, no, sila yung mga genetically engineered na mouse, no, in which researchers have inactivated or knocked out an existing gene. Okay, so an existing gene, no, gina-replace nila or gina-instruct nila with an artificial piece of DNA. Okay? So, magkakaroon ng changes in the mouse's phenotype, no? So, mag-change yung appearance, behavior, and other observable physical and biochemical characteristics. Okay, so for your adult stem cells or near stem cells, they are often given the term totipotential or pluripotential, no? And are ubiquitous even in your blood. Okay, so it can be marrow or non-marrow, no? Sa non-marrow reserves in your marrow, you have your hemocytoblast or your hematopoietic stem cells. So, dun mag-produce ng blood. Okay? So, this is the diagram for your cell differentiation, no? And they are started by your growth factors, no? So your marrostromal cell can be thought of as being the mother of all mesodermal cells. So epithelium, no? Yung sabi ko kanina, epithelium is generally thought of as an arising from your ectoderm or your endoderm, while your stroma or your connective tissue, no, is thought to be arising from your mesoderm. Okay? So we have your growth factors. So, the general features of your growth factors are for locomotion, contractility, differentiation, and angiogenesis. Okay, so what are your growth factors? You have your epidermal, transforming your alpha or beta hepatocyte, vascular endothelial, platelet-derived fibroblasts, keratinocyte, and cytokines. You have your TNF, interleukin 1, and interferons. Okay, so what are the cell players, no, the source and their targets, no? It can be your lymphocytes, especially your T cells, macrophages, platelets, endothelial cells, fibroblasts, keratinocytes, mesenchymal cells, and smooth muscle cells. So for each growth factor, no, kailangan malaman mo saan siya ginawa, anong gagawin niya, at saan siya papunta. Okay? So minsan naman yung pangalan niya is very, very, no, very suggestive. Okay, first is your epidermal growth factor. Okay, they are made in your platelets and macrophages. They are present in your saliva, milk, urine, and plasma. Okay, they act on keratinocytes to migrate and divide. So they act on fibroblasts to produce granulation tissue. Okay, your transforming growth factor alpha. They are made in macrophages, T cells, and keratinocytes. It's similar to EGF, also effect on hepatocytes. Okay, your hepatocyte growth factor, they are made in your mesenchymal cells. Proliferation of epithelium, endothelium, and hepatocytes, no? They have an effect on cell motility. And ito, no, always siya makita sa research, no, your vascular endothelial growth factor, kasi usually ito yung Um, ito talaga yung inaaral, no? Kay why this is triggered by hypoxia. So this is made in your mesenchymal cells. It increases vascular permeability. So, pwede siyang makagawa ng bagong dahilan ng blood. So, something would survive more. Okay? So, mitogenic for endothelial cells, key substance in promoting granulation tissue. Okay? Platelet-derived growth factor. These are made in your platelets but also many other cell types. So chemotactic for many cells, mitogen for fibroblast, angiogenesis, and another key player in your granulation tissue. Your fibroblast growth factor, these are made in many cells, chemotactic and mitogenic for fibroblasts and keratinocytes. Reepithelialization, it's for angiogenesis, no, new vessels, no, wound contraction, hematopoiesis, cardiac skeletons, created muscles. Okay, your transforming growth factor beta, these are also made in many cells. It's chemotactic for PMNs and many other types of cells. No, it inhibits epithelial cells. This is fibrogenic and anti-inflammatory. Your keratinocytes growth factor, this is made in your fibroblast, though it stimulates your keratinocytes for migration or motility, proliferation, mitogen, and differentiation. We also have your insulin-like growth factor 1. These are made in your macrophages, fibroblasts. It stimulates sulfated proteoglycans, collagen, keratinocyte migration, and fibroblast proliferation. So its action is similar to your growth hormone or your pituitary growth hormone. Okay, your TNF or your tumor necrosis factor alpha and beta, they are made in your macrophages, mast cells, and T cells. Okay, they activate your macrophages. This is a key influence on other cytokines. Okay, your interleukins, they are made in your macrophages, mast cells, and T cells, but also many other cells. So what is its function? It's for chemotaxis, angiogenesis, and regulation of other cytokines. So your interferons, they are made by lymphocytes and fibroblasts. They activate your macrophages. It inhibits fibroblasts and regulates other cytokines. Okay, for signaling, okay, must know terms, autocrine, pag ang sinisignal niya is yung same cell, no, sarili niya. Auto. Paracrine, next door neighbor, no? Kailangan to ng many growth factors. Endocrine, far away, no? Kay layo naman siya, no? This is usually delivered by blood, no, your steroid hormones. Okay, so you have your autocrine, sarili lang niya. Paracrine, no, adjacent target cell, kailangan to ng mga many growth factors. And endocrine signaling, no. Kasi far away, kailangan niya mag-travel sa blood vessels. Okay? Excuse me. Okay, you have your transcription factors, no? They take order from your growth factors. So, again, your transcription factors, they take orders from your growth factors. So, a transcription factor sometimes is called your sequence-specific DNA, no? This is a protein that binds to specific DNA sequences. Okay? Your extracellular matrix, no? You have your collagen 1. Meron yung listahan mamaya, no? Then you have your ECM or extracellular matrix, no? Made of collagen, elastin, fibrillin, your CAMs, your cell adhesion molecules. No, you have your immunoglobulins, cadherins, integrins, selectins, your proteoglycans, and your hyaluronic acid. Okay, there are 18 types of collagen, no? In which your type 1 is actually the most common. Okay, so anong pulos ng ECM, no? They maintain your cell differentiation, no? And it provides as a scaffolding. So anong scaffolding, 'di ba, pag naay gina-construct na building dito sa gawas, 'di ba? Na sila ginahimo nga latayan, no? So that is your scaffold. Okay, yan din ang pulos niya sa cell. So they establish your microenvironment and also silang nag-store sa growth factors. Okay, 4 of the most important collagen is first your collagen 1. It's the main component of your bones. Your collagen 2, cartilage, no? Main component of your cartilage, no? Collagen 3, reticulate, no? Main component of your reticular fibers. collagen floor forms the basement membrane. Okay, these are your genetic collagen disorders. So first is your osteogenesis imperfecta or pwede din your Ehlers-Danlos or ED, no? Meron silang hyperelastic skin. Okay, type 2 genetic collagen disorder, we have your achondrogenesis 2B, no? Yung 2, you have small body, no? Short ang limbs. You have your 3 vascular Ehlers-Danlos, classical ED yung 5. Stickler syndrome, no? They have very distinctive facial appearance, eye abnormalities, hearing loss and joint problems, myopia, absent nasal bridge, and hyperelasticity. We have your Alport syndrome, no? This usually kidney to, glomerulonephritis, end-stage kidney disease, and hearing loss. Your Bethlehem myopathy, progressive myopathy, your ankle fingers, your joints, dystrophic epidermolysis bolus, no? This is a blistering disease. Your Knobloch syndrome, no? Ophthalmic and retinal abnormalities. Okay, so don't forget, no, your regeneration versus your healing. Okay, healing starts before the end of inflammation. Okay, if you remember the three possible outcomes of acute inflammation, that would be completely nag-regenerate, pwede din maging chronic inflammation, and pwede maging fibrosis, no? Healing is the usual process before you get to one of these three final outcomes. Okay? So your angiogenesis, no, or new vascularization, new blood vessels. So, no, from endothelial precursor cells from pre-existing vessels. No, dapat may pre-existing vessels. Okay, stimulated, regulated by your GFs, pero especially, no, your VEGF, no, yun yung sabi ko kanina. This is also regulated by your extracellular matrix proteins, no. It can be also called your granulation tissue, organization, neovascularization, organizing inflammation. Okay? So, eto, no, days after wounds, no, you have inflammation, proliferation, and maturation. Okay? So, in which phase would you see the fibrin? The answer would be inflammation. Kailan mo makikita yung scar? Sa maturation. So, which phase is characterized by prominence of your budding or your blood vessels? Proliferation. Okay? So, this is very important. This is the difference between your healing by first intention and healing by second intention. Okay? So, healing by second intention involves a much greater destruction of your extracellular matrix. So, therefore, no, it is more likely to produce a greater amount of fibrosis. So, so the greater kesa nito, di ba? Healing by first intention. Okay, so the degree of fibrosis is directly proportional to the amount of destruction or disruption of the ECM. So, this is difference between your first and second intention, no? Are the edges of the wound line up, no? Pag first intention go, so kani usually ginatahi ni direction, no? With a suture, no? Pero if dili sila line up, the edges do not line up, no? More, kailangan nila more granulation, more epithelium, more fibrosis. So, dili ni ginatahi. Actually, ginahayaan lang siya by mag-heal by second intention, no? The wound healing. Okay, so these processes, no, your regeneration healing, no, they parallel the appearance and regression of cells, no. Example, your neutrophils, no, your macrophages, your endothelial tissue cells, and your fibroblasts. Okay, so inflammation, ano ang responsible pa niyan, no? Usually is your neutrophils and your macrophages, no? Granulation tissue, endothelial cells, then fibroblasts, no, nasa wound contraction. Okay, so your healthy granulation tissue would sometimes looks like it's infected, no? May mga patients na, hala, infected naman ni siya, no? Pero sometimes it's actually not infected, no? This can be unhealthy granulation tissue. Okay, so fibrosis or scarring, deposition of collagen by fibroblasts. So with time, weeks, months, or years, the collagen becomes more dense, ergo the tissue becomes stronger. So wound retarding factors, no, decreased blood supply, denervation, local infection, no, hematoma, mechanical stress, and necrotic tissue. Okay. So um anong pag ito local, no, decreased nag stop siya ng healing, no, decreased blood supply, no, hindi first of all, hindi nakakaabot ang blood doon. So, paano siya mag-heal, no? So, ayan. Bakit hindi nakaabot ang blood? Denervation, may local infection, hematoma, mechanical stress, necrotic tissue. No? Pwede clarify sa mga meaning sa FB. Okay? Or pwede po siya maging systemic, no? Because of decreased blood supply. Why? Because of your age, no? Anemic ka, may malignancy na nangyari sa'yo, malnutrition, obesity, infection, and organ failure. Okay, that is it muna for the regeneration and healing. Thank you so much.